Good afternoon, everyone. It's Mark Polenkars coming to you live from the Rath Building with another COVID-19 update. I'll be joined very soon by our Health Commissioner, Dr. Gail Burstein. And of course, we're joined by Kendra Schmidt from Deaf Access Services, who will be providing the American Sign Language for today's media update. I just want to note before we go into all the details that, as you may have heard, we don't have all the full data on it yet, but the governor announced just recently that 9 individuals died in Erie County yesterday. We are pulling that information up, but it just goes to show how deadly COVID-19 is. When I say 9 individuals died yesterday, I'm talking about 9 individuals died that had COVID-19, not just 9 individuals died in Erie County. Just goes to show how dangerous COVID-19 can be, as we'll show in some of the data upcoming. There are individuals already in the month of November in their 40s and 50s who've died from COVID-19 in Erie County. And while we don't have all the data yet with regards to the individuals who died yesterday, and we'll probably not get that until later tonight or tomorrow, I just want to remind everybody this is an exceptionally serious situation. We've had a rapid growth of cases, doubling basically on a weekly basis. We've had increases in hospitalizations, increases in deaths, and this is not something that should be laughed at. This is not something that should be trifled with. You need to wear your mask. When you're around people that you haven't, other than your basic home, you should be always wearing a mask except for the people that you're around at your house. It's one of the reasons why we make a recommendation that you do not have Thanksgiving with anybody else other than your immediate household, because this is bad. It's getting worse. We're very worried about where we are, and unfortunately there are people who passed this most recent period who people were probably planning on having Thanksgiving dinner with. There are empty chairs at tables that people thought would be having holiday dinners with, and they're not going to be there now. And I offer my deepest condolences to the loved ones and friends and family of those who have passed from COVID-19. This is real, it's not going away, and we all need to be in this together to protect each and every one of us. With regards to the case data, this is as of yesterday. There were 17,869 total positive cases in Erie County since the beginning of the outbreak, and as we'll get into, 16% of all those cases occurred in the week that ended on November 14th. So it is very distressing on the rapid growth of cases. 746 people had died as of yesterday. It does not include the 9 that the governor announced today. So we would actually have 755 individuals who've died in Erie County as a result of COVID-19. And all of these are actual cases, known positive cases before death. An individual had a positive case before death. On November 14th, there were 156 individuals admitted to Western New York hospitals for COVID-19, 129 of them in Erie County, and 27 Erie County patients were in the ICU, and 8 had an airway assist. That's as of the 14th. This chart you've seen a lot of lately. It's the 14-day chart. We've seen a steep increase in hospitalizations over the past week. And the most recent data for the 14th shows that nearly 50% of all patients in the hospital with COVID-19 were 64 and under. I've confirmed with hospital leaders, including those at Kaleida, as well as Catholic Health, that they are seeing a rapid increase in hospitalizations, and there are many more people coming to the hospital now who are under the age of 60 than there were early in the outbreak. We believe it's because there are things that are still open, people are not taking it seriously, and therefore there's a greater risk of individuals who are younger who otherwise probably would have been locked down in April and May getting sick. So this is very, very concerning. And then we've added a new graph, kind of going back old school, which you'll see in the next slide, in which we look at the cases in Erie County from the beginning of the outbreak until today. And this will really show you the rapid rise in the last week. That line from the week of November, really from October 30th, but really November 6th to the 15th is going straight up. And this does not include yesterday's hospitalizations, in which we believe there were newer hospitalizations as well. So you see the beginning dating back to April and March, in which we had the rapid increase, and then it leveled off, and then it slowly dropped down, and we were stable through most of the summer. You see that rapid increase again. Hospitalization numbers are shooting, and Unfortunately, it looks like they'll be shooting through the roof unless we control it. The one good thing is ICU numbers have not increased at the same rate as hospitalization numbers. We do know the hospitals have better ways of treating COVID-19 patients. And one of the things that we're also reminding everyone is if you are really sick, don't wait till the end. Go to the hospital sooner. They have a better chance of saving you, of getting you out of the ICU and getting you back home quicker if you go to the hospital quicker. So if you're really sick with COVID-19, don't wait until it's too late. Go there sooner to the hospital so you can be treated with the new treatments that exist, and there'll be a much greater chance that you will not be in the ICU, and even if you're in the ICU, you will survive. But this blue line is scaring the heck out of us because it's going straight up. And unless we can control that, it's quite possible very soon, because we've been seeing on average of 10 new hospitalizations per day in Erie County, that we will be at a greater hospitalized rate than we were in the spring. Mortality data, this is something that's very, very important. We've broken it down and looked at it by age groups through the months, and you'll see that this is before the most recent data was announced by the governor, but for November there were 15 individuals who died of COVID-19 in Erie County for the month of November. There were 8 males, 7 females, 9 white, 4 black, African American, 2 Asian. 9 of the deaths were associated with persons in a private residence at the time of the initial infection, which means they were not in a hospital, they were not in a nursing home, they were not in an assisted living facility, they were in a private residence, a house or an apartment. So these are individuals who caught it, probably from general community spread. The average age of the deceased for the month of November prior to these most recent 9 cases is 71. And if you look, it's dropped from where it was the most recent couple months, where it was 84 in September and 79 in October. August had the lowest number of by average death, but it also had the lowest number of deaths. So it really was kind of a outlier. But what we're seeing are more people who are younger dying. There was 1 individual already this month under the age of 40, 3 between the ages of 50 to 59, 2 between the ages of 60 to 69. So just because you think you're feeling good, you're 52 years old, everything's great, doesn't mean you're not susceptible to a serious illness from COVID, or for that matter, death. This is scary. This is not good. We're not happy to see this because it means that COVID is striking more younger people and having serious impacts. And we also know that there's long-term impacts that can result from COVID. We look at the total mortality data. Once again, this is as of November 15th. It doesn't include the 9 that were announced by the governor. And you'll see that it's still, the vast majority of individuals are over the age of 80, but we have been seeing growth in the smaller categories, the lower categories. And then the mortality data, the totals for November 15th, based on race and ethnicity, very similar to what we've seen for months now. The percentage of African Americans has been about 16%. They make up a little less than 15% of the population of Erie. Hispanic Latino, it's only about 2.5% of fatalities. They make up a little less than 6%. So we're not that far off from our ethnicity and race data, but we are very concerned, as we always are, about any death. So once again, to all those who've lost a loved one, you certainly have my condolences. And there's some individuals out there, some family members and friends of individuals I know who were lost in the last week that I know personally. I don't know the people who perished, but I know some of their friends and family, and you certainly have my deepest condolences in what is one of, truthfully, the saddest time of your life. I'll turn it over to Dr. Burstein to talk about testing and diagnostic rates, but just one more before I get back up here is this is serious, this is real, this is not a hoax, this is not fake. And we are all in this together, which means we all have to wear our masks pretty much everywhere, except in your immediate work environment if you're sitting alone at your desk or your house. And I'm putting my mask on.
Thank you, and good afternoon. So these are data looking at the number of tests, that were positive, and the proportion of positive tests from the week ending October 10th through this past week ending on November 14th. So you can see in the past couple weeks we've seen an exponential rise in the proportion of positive tests and the number of positive tests in Erie County. And actually, 31% of all the Erie County cases reported since the beginning of the pandemic were in the last 4 weeks, and 16% of all the cases reported in Erie County since the beginning of the pandemic were just in the past week itself. And the positivity rate this past week ending on November 14th was 5 times higher than it was just a couple weeks ago, the week ending on October 24th. We are seeing an exponential rise in our cases. Our reproductive rate is 1.5%. So is 1.5. So for every one person that is infected, we can expect 1.5 person to get infected as a result of that one person. This is a bad situation. So these are data looking at the number of people who were diagnosed in this past week by zip code and city and town. So you can see that although there are certain areas that have higher number of cases, and that is very concerning, you can also see that all areas, these are the I think the top 20 zip codes. And we're seeing there are many areas that are highly densely populated, and also that have a lot of cases. So there is no place that is safe. We're seeing particularly a lot in the Hamburg area, Amherst, Clarence, Lancaster, and in the city of Buffalo. So in both the northern suburbs, the south towns, and in the city of Buffalo, we're seeing a lot of positive test results. And we're seeing a lot of cases in schools, unfortunately. So this slide is looking at data of the number of cases that we have reported from schools, both staff and students. So if you recall, in the beginning of October, we had anywhere between 15 to 30 cases, and then at the end of October we started to see an increase, and then this past week, the week ending November 14th, we saw 189 cases in schools. So, and I think many people know who have kids in school that this is a problem, and people that work, and we know that schools are starting to close down, not only because of the number of cases in the school, but because they can't get the staff they need because there are too many people in isolation or in quarantine. So this is a huge problem in our schools too. And many schools have been forced to offer remote learning only. So what do we need to do? How can we get over this? First of all, what we have to do is stay at home. Just stay at home. Stay away from anybody else that does not live in your household. And if you do go out and you're going to be around other people, wear a mask. And masks are very protective. And then, unfortunately, it's the holiday season, and people are planning Thanksgiving, people are planning shopping expeditions, but we have to stay at home or cancel these gatherings and postpone them to another date until the spring, when we hopefully will have a vaccine. But this is something that we can't have large gatherings. Even small gatherings, we're seeing what we see, living room outbreaks, just a few people in a living room, and we're seeing outbreaks of that. So we really have to protect the people that we love from COVID-19, and so we can't have our grandparents and our parents over for Thanksgiving dinner this year. We have to protect them. So actually, there is Georgia Tech has a tool that they look at data of reported surveillance data of COVID-19 to estimate the likelihood that if you have a gathering of a certain amount of people, what the likelihood is that there'll be at least one person in your gathering that will have COVID-19. And so they do this by county. So for Erie County, we just got this off their website today. So if you are planning a gathering for just 15 people somewhere in Erie County, there is a 22% chance that at least one person in the gathering will have COVID-19. And then if you're planning a gathering with more people, say 50 people in Erie County, there's a 56% chance that at least one person in the room will have COVID-19. We know how contagious COVID-19 is. It's just not worth the risk. Even a small number of people can transmit infection. So what do you need to do? If you have a positive COVID-19 test result, isolate for 10 days. You don't have to wait for a contact tracer to call you to know to isolate for 10 days. If you are symptomatic, it's 10 days after the onset of symptoms. If you didn't have symptoms, it's 10 days after you had your specimen collected for the test. So stay at home. Medical care, as the county executive mentioned, if you need to go to the hospital or be seen by a healthcare provider, that is the only reason you should go out of your room. Monitor your symptoms. Remember, you have to make sure that you don't wait till it's too late and you're really sick before you go to the hospital. You want to stay in a separate room if you live with other people in your household. Remember, you don't want to contaminate them, and use a separate bathroom if you can. If you can't, you want to make sure that you disinfect the bathroom after every time you use it. And again, don't share any personal items. Don't share any utensils or cups or towels or anything. Just stay away from everybody else in your house. And then if you do have to go outside for any reason of your room, please wear a mask. It not only, you're not wearing it to protect you because you already have COVID-19. You're wearing it to protect other people in your house. And remember, if depending on your symptoms and the situation, your isolation may have to last a little bit longer than 10 days. That's something that you can discuss with your healthcare provider. And then, if you've been notified that you've been a close contact for COVID-19, you have to quarantine for 14 days from that last date of exposure. What does quarantine mean? It means stay at home. It's the same thing as isolation. You have to stay at home in your own room, in your own space for 14 days. It's very important that you check for any type of symptoms, like a cough, fever, shortness of breath. If you do get symptoms, it's very important that you get a test. Even if you don't get symptoms, a good time to get a test, just to make sure that you know your status, is about 5 to 7 days after your last contact. But please stay at home, stay away from everybody, especially people that are very vulnerable to getting very sick, like our elderly and people with other health conditions. And remember, we have to trust science here. We know science is right. Do not ignore public health messages. Do not ignore what we're saying today. We know that the information changes daily, so we should tune in daily to listen to the public health messages because they are true and they will save our lives. And then also, if you have any questions about your own health with COVID-19, talk to your healthcare provider. Don't look it up on the internet or some blog. Your healthcare provider has valid information. And remember, check your sources. If you go online to check facts, go to the Centers for Disease Control Prevention's website, go to the, American Medical Association, the Erie County Health Department, or the New York State Department of Health. Also, Erie County is still offering COVID-19 testing, but we have changed our criteria. So we're offering COVID-19 for residents who are either close contacts to a confirmed case, so people who are already under quarantine, either they have symptoms or they don't have symptoms, it doesn't matter, we still want to test them, or Erie County residents that do have COVID-19 symptoms. Again, we do want to test you. You are at high risk for having COVID-19. You call 716-858-2929 to schedule. Remember, it's free. There's no insurance. You don't need a physician's order, but it is by appointment only, so we do need you to call. And then we're begging people, please do not travel. New York State has a travel advisory, and the Erie County Health Department is also chiming in and urging Erie County residents, do not travel. Don't travel to other states outside of New York State. Don't even travel to contiguous states. All these states have very, very high numbers, and it's not worth the risk of returning infected. So individuals that are going out of state that are not in the contiguous states have a mandatory quarantine, although they have an option to test out of that mandatory quarantine for 14 days. If they get a test 3 days before they return to New York State, and then get a second test 4 days after they're back, and if both tests are negative, then they can end their quarantine early. And then all the information and the way to report that you've been traveling or somebody you know has been traveling is on the New York State's website on their travel form. So now we will talk about Erie County Response. Do you want me to take it or you want to take it? Sure. Oh, sorry. Do you want to take it or? Yeah. Okay.
Thank you, Dr. Burstein. We are still in the yellow microcluster zone. A lot of people were asking, was there going to be a change? Or was the governor going to announce? I've spoken to the lieutenant governor multiple times recently. I've been communicating with the governor even by text, as well as communicating with the staff. And I've been told no decision will be made today by the state. They are examining the data, which kind of makes sense because when we went into the yellow microcluster zone, it was basically a week ago. They want a full week's data sort of after the announcement. Today's data that we will review will be for yesterday. So tomorrow they'll be looking at the data for Monday, and we want to see a downward trend. Unfortunately, we really haven't seen a downward trend, but I'm expecting New York State to have further communications with us over the next 24 hours in regards to whether or not it will move into an orange or a red, or whether there'll be an expansion of the yellow microcluster zone for other communities, because we have seen growth in other communities that we've talked about, like Evans as well as Springville. So, of course, the statewide microcluster rule, or I should say the New York statewide rules and the microcluster rules, all restaurants, bars, and gyms must close at 10 o'clock, regardless of where they are in New York State. So everywhere, Niagara County, Chautauqua County, Cattaraugus, Genesee, as well as the non-yellow zones in Erie County must close at 10. The yellow cluster, they've made a little change in the last few days with regards to gatherings. 25 people maximum for indoor and outdoor non-residential gatherings. So if you have a non-residential gathering, you are allowed 25 people. So that basically means some offices, meetings that may exist in a public building. If it's a residential gathering, it is a limit to 10 in the yellow cluster zone. And then, of course, in the yellow cluster zone, bars and restaurants are limited to 4 per table, and schools must test 20%. There's been some changes to those rules as well, giving the schools more time. So we've been getting that information from New York State, and we'll continue to share that with the schools as we get them. I know a number of schools have gone virtual since last week's announcement. Not all of them have. And they're still trying to work on the issues with regards to testing. We'd like to remind all the school districts that New York State has provided to you an email to request tests through the New York State Department of Health, the Binax tests. We have limited capacity here. It's one of the reasons why we cannot take over testing. But New York State will send test kits to school districts, charter schools, private schools, based on the request if they're in the yellow zone, and that information has been provided to school districts already. Once again, we are in a serious situation. We are seeing rapid growth of cases, rapid growth of hospitalizations, and unfortunately as well in death associated with COVID-19. I'm asking everyone to take this seriously. This is not a joke. This is not a hoax. I know there's a lot of folks who just want to say, you can't say what I can do. Well, I don't want people to think we don't want you to have Thanksgiving. We'll just have Thanksgiving with your immediate family. And you want to get the best example of it? Our friends to the north in Canada had Thanksgiving in October. And they're already getting statistical evidence now that shows that at many of their Thanksgiving ceremonies in October, COVID was passed from one family member or friend to another. And it's helped drive the cases up in Canada. So we already know what the experience is like just a few miles over the border and through the rest of Canada. We don't want to see that same thing here, especially when we've seen exponential growth in the last few weeks. Let's all try to do a better job of ensuring that we're wearing masks when we're out in public, but especially if we're at a small gathering. I know that there were some gatherings for yesterday's Bills game. The result wasn't what we wanted. There's certainly no doubt about that. But the worst thing that could happen from one of those Bills games gatherings is if someone gets sick from COVID and dies. So please, limit the amount of gatherings that you're attending. If you're going to have Thanksgiving, go ahead and have Thanksgiving, but only with your immediate family. Please do not invite others over, and do not go to their locations, because you are only potentially putting yourself at risk for COVID-19 and then spreading it to others. We are all in this together. We have to do a better job of trying to stem the tide of COVID-19 cases. We are also, as a government and leadership, trying to not do a complete shutdown like we saw earlier in the year. We don't want to have to shut down the whole community and further destroy the economy. That's why we're trying to do this in a method that allows our community to get through it without dramatic rises to the point where we have no choice. So it's in everyone's hands. If the decision is made to have to shut down further parts of the community to go to the orange or red zone, it's not because myself, the governor, or public health officials want to do it. It's because we have no choice. It's because we as a community could have stemmed the tide, but we didn't. That's why I'm asking each and every one of you, please do your best. Wear your mask when you're out in public. Wear your mask if you're in a location that's not your immediate office, or for that matter, your house. Do the best to protect others, and we will get through this as best as we can, hopefully with less deaths than what we've been seeing in the recent weeks. Though I am fearful if we do not change, we will see many more, and it'll be maybe not as bad as it was in the spring, but it will be bad, and none of us want to deal with that. So with that, I will open it up to questions. Remember, to the members of the media, you need to unmute your phone, which is *6. And we started, I think, with the A's the last time, so we'll start from the top or the bottom of the alphabet, and we'll start with WBFO. Is anybody on from WBFO? How about WBEN? Anybody on from WBEN?
Hi, Mark. It's Brendan Keeney.
Hi, Brendan. Go ahead.
Just a question regarding schools. Obviously, a lot of people are concerned about shutdown of schools. Can you just talk about superintendents feeling like that go through New York State? They feel like the county no longer is partnering with them. Can you just talk about that in response to that?
Well, it's not so much the county is no longer partnering with them. We're sharing information with them. The problem is the type of public health lab we have and the staffing that we have. We are providing significant amount of testing for the general public, but if we were to stop everything that we were doing and just work with the schools, we would no longer be able to provide the testing for the general public. We just can't do that. There's almost no other county. Actually, there is no other county in upstate New York that has the public health lab, a CDC-approved lab like we do. And we have different stringent requirements. Most of the other public health departments in upstate New York, and for that matter, even Long Island, don't have a public health lab like we do. So when they talk about the assistance they're getting from New York State, it's really no different in their local counties. It's not that different from what we're doing. It's just they expected us to do all the testing for them, and we cannot do all the testing for the schools when we are potentially talking about tens of thousands of tests on a weekly basis. So we are asking the schools to do what New York State has requested of you as well, which is send your requests for testing kits to New York State. We will assist you in trying to talk about how we can test appropriately, but the Department of Health does not have the staff to be able to test all those students and staff. And moreover, if we focus solely on schools, we would have to stop everything else that we're doing, and we can't do that. Next question, to the Buffalo News. I think Sandra Tan and Aaron Besker are on.
Yes, Mark, thanks. Can you talk a little bit more about hospitalizations? I know that there was some cautious optimism previously that even though we're seeing high numbers of confirmed cases, that hospital capacity would not be as affected, and I'm wondering if the thinking on that is changing.
Well, hospitalizations certainly have shot up. Here's the last 2 weeks, and you'll see it's on average the last week about 10 new hospitalizations per day, so it means it wasn't that long ago. It was in the 60s, and now it's over 120 as of the 14th, and I expect that number to be higher for the 15th. The one good thing, as we've noticed, the hospitals have been able to treat people as soon as they come in with different treatments that they couldn't do necessarily in the spring, so some of the cases are not immediately having to go to the ICU. We do know that the hospitals are getting tighter. There's a couple of hospitals that have less than 10% capacity in full, not just with regards to the ICUs. And there's others that they're looking at potentially slowing down elective surgeries and the like so that they can handle what is expected to be a continued influx of patients. As I say, this chart that I have now up on the screen is, I think, very indicative of what we're seeing when you look at it over the grand scheme of time and the rapid increase in just basically 10 days. So we are concerned about what's happening. Thankfully, we are not seeing as many ICU cases, but as was noted, we are seeing an increase in deaths. And the number that the governor announced earlier today for yesterday, 9 deaths in Erie County, is horrible. We haven't had 9 deaths in Erie County in one day in a long, long time. And I'm very concerned that if we can't control the tide of this, we will see a continued increase. And the other thing we've noted is if you look at the age ranges, we are seeing a greater proportion of people who are dying being of younger age. Our average death age has dropped to 71. And since just the beginning of this month, so just since November 1st, we've had 4 individuals under the age of 60, 59 and below, and 6 individuals under the age of 70 who've died from this. So this is serious. This can strike even younger individuals or those that would not necessarily consider themselves elderly, but young at heart. So we are concerned, and we're working with our partners in the hospital systems. At various times over the last few days, I've communicated with Tom Croce from ECMC, Jody LeMayo from Kaleida Health, and Mark Sullivan from the Catholic Health Systems to continually know what's going on in their hospitals. And they're all saying the same story. We're seeing more people who are younger coming into the hospitals than we did earlier. We can do a better job of managing their care because we have different ways of treating COVID-19, but that does not necessarily mean that if you get very sick, you will not be in an ICU or, for that matter, die. So we are concerned. Next, is anybody on from Channel 7, WKBW? Not, we'll move on to Channel 2, Kelly Dudzig.
Hello. So when you look at moving into an orange or a red zone or possibly expanding the yellow zone, what kind of data are you looking at? What goes into making that decision? Because I think a lot of people and businesses are worried about the potential of moving into an orange or a red zone.
Yes, and I think a lot of businesses and people should be worried because the numbers are significantly higher than we were hoping they would be at this time when we talked about this last week. The data that's being looked at is the specific data with where these cases are occurring. Zip code data, of course, even breaking it down to neighborhood data. So let's say you have a zip code where you have multiple neighborhoods in them. 14221 is a very good example of that. I'll just pull up the zip code data. 14221, which is the second highest based on cases, is in Amherst and Clarence. It's even a little tiny piece of it in Cheektowaga. But on this chart that you see up here, you see something that I think is very important that the state's looking at, and that's new daily cases per 100,000 population on a 7-day average. And the highest one is the one with the highest number of cases in total, which is Hamburg, in which there's basically 78 people per 100,000 that are new cases on a 7-day average. Amherst, Clarence, 14221 drops to 43.5, but then you see the next one, Lancaster, 65.9. So we're looking at data like this, and we're talking to the state about this type of information. They're also looking at hospitalization data to see, is there a greater preponderance of people coming from a particular location that are going to hospitals? There is no one driving factor. I mean, everyone's looked at the numbers. We release that on a daily basis and the 7-day rolling average, and they're saying, oh, we're going to go orange or red on Monday. Well, unless something really difference happens in the next few hours, I do not believe we're going to go in orange and red today because there's going to be further discussions between the state and the county. But I think people this is why we included this 100,000 population on a 7-day average in the chart, is because this is a key metric that the state's looking at. So in itself, the number of cases may not be a driving factor because there could be, and on some of the smaller zip codes that we don't have on the screen here, but we can release that information to the media. There are some zip codes where they might only have 35 or 40 cases, but because of their population and the zip code being smaller, they could be in the 60 to 70 per 100,000 category. So we want people to understand that there's no one driving factor, but new cases are going to be seriously considered as it pertains to the percentage of the population. If we go orange and red, and I think there's a chance that portions of our community will go orange and maybe even red, I do not expect it to be the whole community. I expect it to be particular regions of serious concern. That being said, just because your area is not in the yellow now means that you can do whatever you want. You need to be concerned because there's areas that are not in the yellow that could be in the yellow. And if areas go into the orange or red, that doesn't mean you just travel into the other areas that are not orange and red, because you're still going to see it because there's high rates of cases everywhere. WIVB, George Rickert.
You mentioned, taking off of what you just said, is it possible that if more restrictions come in the next couple of days, it would be a smaller unit than the current yellow zone? And I guess my second part is, over the weekend, the overall yellow zone numbers seemed to stabilize, or at least not keep going up. Will that affect what happens in the coming days?
Regarding the first part of the question, the answer is yes. It is quite possible, and if you look at the other cluster zones across New York State, there's usually a very large yellow zone and then a smaller orange and maybe even a smaller red. So I would not be surprised if the description or a statement from the state comes out that these are the areas that are moving into orange, these are the ones that are moving into red. Because if you look at the cluster zone strategy, it's to pinpoint in a narrow area the micro outbreaks. Well, our problem is we don't have micro outbreaks, we have macro outbreaks. But there are some areas that are doing better than others. So it would not surprise me to see the entire yellow zone still say yellow, but they have orange and red ones picked out. And in regards to the second portion of your question, I guess the only way I can is yes. I mean, it's yes to in both portions of the question. It's quite apparent that what we're seeing is growth across the community, but thankfully over the last couple days it seems to have at least leveled off. Now, if we get a few more days of data and we're seeing 9% and 10% as an average growth, we've got big problems. I think people are starting to take it a little more seriously. The problem is a lot of the new cases from last week are individuals who may have been infected from the week before. So it really does take a week's time to see if an individual, if the actions that we're taking today are going to make a difference a week from now. So if somebody tested positive yesterday, they started feeling ill on Saturday, they may have been infected up to 14 days before that. So it's possible that they were infected 2 weeks before or a week before. As the doctor noted, usually by the 9th day of exposure, if you're going to show symptoms, usually show it by then. But it's not the only case. There are individuals who don't show symptoms until the 10th or 12th day of exposure. So I'm hopeful that we will avoid further shutdowns, but I'm not really thrilled with the numbers we've been seeing. At least there's been some stabilization over the last couple days. But the one thing I will note is for it to be, let me just pull up the number here. Where are we here? I was looking for yesterday's. It's not necessarily on there. But for the last week, it's 6.7%. And I'll remind you, in that 6.7, there were areas that were 3.5 to 4, and there were some areas that were 10 or 11. And the same thing goes with the daily numbers, George, is that if we're 7% or 6.5, that means there's some areas that are 3.5 and 4, and there's others that are 8, 9, and 10. So it's the ones that are in the 8, 9, and 10 category repeatedly that are of a serious concern. Could the state turn it all to orange? Yes, they could. I'm hopeful that we take an approach that ensures that we don't shut down our economy, but we stem the tide. And that's why it's in the hands of the public. It is in the hands of the public to stem the tide by taking the actions today to ensure that we and others don't get sick tomorrow. Spectrum News, Aaron Ty. Spectrum.
Yeah, hi, Mark.
Hi.
Just a question about those numbers that Dr. Burstein threw out earlier. If 50 people are gathering and there's a 56% chance at least one of those people is are infected, should stores like Target, Wegmans, Tops be limiting the number of people they have in the store? There's surely more than 50 people in a store at a time.
Well, when they're talking about gatherings, Aaron, they're talking about like close gatherings. Going into a Target or a Walmart or a Wegmans is not the same as having 50 people in the same room. There's a reason why we are back to basically having virtual press conferences and limiting the amount of people in this room. Because if we had, and the capacity for this room is 49, though we generally have had no more than 20 to 25 in here at a time. But that's a higher risk than if you have 6 or 7 people. So when they talk about gatherings, they're really talking about events that are going on. People are going to a picnic shelter themselves. They're going to senior dining, which we've canceled as a result of that. It's in a closer quarters, even if it is outdoors. At least it's people coming together. They don't necessarily consider gatherings going shopping at a supermarket. But I will remind everybody, the stores have restrictions in place. None of them can be above 50% capacity. And if you walk into most stores, you will see someone at the door keeping track of how many people have entered. And if they get above their capacity, they actually have to stop and not let more people in. We know that's caused problems. We've had retailers who said, people just won't listen to us. They'll swear and they'll say, just give me what I want. But no, we've got to follow the rules. So there's a lot of good retailers that are trying to follow the rules and keeping track of how many people are in a store, to a point where if they get to a tight-knit situation, then they're going to have to refrain from letting more people in. But the gathering risk assessment tool is really with regards to closer in having a meeting with your coworkers. If you've got a meeting with your coworkers with 15 people in a room, as it says, there's a 22% chance that one of those individuals has COVID. And that's not good, because there's a good chance if that one person is in that room, they're going to spread it to others. So the gathering is more talking about bringing together in a tighter quarters as compared to a supermarket or a superstore. B News, anyone on from B? Any other media that I did not call on or did not answer in time earlier?
This is Fadia Patterson from Spectrum.
Hi.
I just had one quick question about testing. How does the flu season impact testing?
I'll turn it over to Dr. Burstein to answer the question. How does the flu season impact testing? Put my mask on.
Thanks. So the question, how does the flu season impact testing? So we know that COVID-19 causes flu-like symptoms, and we know that influenza causes flu-like symptoms. So there's a challenge there to figure out what viral pathogen is causing the symptoms. So that's why we highly recommend, strongly encourage everybody to get a flu vaccine. So hopefully we won't have to think so much about flu this season. However, what many healthcare providers are able to do flu testing in their offices. So I guess if people have flu-like symptoms, they should talk to their healthcare provider to see if they recommend getting a COVID test or a flu test or both. Fortunately, right now, we're not in peak flu season yet. We are seeing documented influenza cases in Erie County, so there is influenza in our community. However, we're seeing much more COVID-19 in our community right now than we are influenza. However, when we get later into the winter season, January, February, is when we typically see higher rates of influenza. So then that's why it's really important for people to, if they develop flu-like symptoms, they should talk to their healthcare provider to see which tests they should get or if they should get both tests. So many healthcare providers do offer rapid flu testing in their offices. Urgent care centers are offering both the COVID tests, and many of them have rapid flu testing in their offices. So you have to figure out with your healthcare provider, which is the better test for you to get. And probably later on in the season, people will really need to get both tests to figure out what they have.
Thank you, Doctor. We'll go back up to the top. Is anybody from WBFO on with a question? If you are, *6. WBN, do you have any other questions, Brendan? If If not, Buffalo News, Aaron and Sandra.
Yeah, hey Mark, can I ask a question? The restrictions that went in place Friday night, what's the county seeing in terms of compliance, the 10 p.m. and the 10-person residential gatherings?
It's actually pretty good. We sent folks out for post 10 p.m. and we found that almost all bars and restaurants were closed. We had some issues where pre 10 o'clock there may have been some mask wearing issues, but nothing to the extreme situation like we saw in the past. So it does appear that bars and restaurants are heeding the state's requirement to close at 10. And if there is an issue with regards to a bar or restaurant, it is maybe a capacity issue or masking. If it's a repeat offender, of course, they'll be fined. If it's not a repeat offender, they will get a warning. And I think that's all we really gave in the last week were warnings. Once again on from Channel 7?
Actually, Mark, can I jump in with a question? This is Sandy Tan.
Hi, Sandy. Go ahead.
Thanks. Regarding just if I could get some clarity on the zip codes with the high percentages of confirmed cases, if the state is going to impose orange or yellow zones, and you said it's likely that it might not be, the entire yellow zone region, can we look at that chart and say, okay, then, is it fair to surmise that these might be areas that might be targeted for orange and red, the zip codes that have the higher percentage of confirmed cases? And I also had a question about death data. I don't know when you're going to be getting the information confirmed from the state about the 9 additional deaths, but in general, is there any way you could release comprehensive death data for the county every day? Because right now we're only getting it for hospitalization.
Yeah, the problem is in the second portion of the question is we work through Healthy Link on receiving death data, and primarily we get it once a week in full set, and then we'll get partials during the week. We don't get it every day except the hospitalization death, and that's not a perfect system because someone could have died in a hospital in Erie County who was a Niagara County or Chautauqua County resident, but it just gives an idea of how many people in hospitals may be dying. If we could provide more quicker, we would, but we also don't want to provide inaccurate data. And that's why we wait till we get the full set of information regarding the individual, because it wouldn't make sense to just say, well, an individual died that was a female. If we don't have where they live, their age range, underlying conditions. New York State gets more data than we do directly because they get it from the hospitals and they get it from the nursing homes. And then they'll also get it from medical examiner's offices and Department of Health like us. So we want to clear out and make certain that when we get the data that it's accurate and that we're not providing duplicative numbers. And we do that. We get that information perfectly once a week, but we usually will try to do it on a biweekly basis. And then on the first part of your question regarding the zip codes, yeah, the zip codes that have higher propensity of cases on an infection rate as well as per 100,000 are the ones that are more at risk. So if you look at the ones on the sheet I have on the page here, which is just the zip codes with 60 or more cases in them, you will see that there are some that the highest is Hamburg, nearly 80, but there are some in the 60s. There are some in the 50s, and there's a greater chance that one in the 70s and 60s is going to have a orange or red zone than, say, one that was in the 20s or 30s, just because there's more rate of infection in that zip code as a percentage of the population. So just saying there's 163 cases in Amherst Clarence makes it sound like it's worse than the 147 in Lancaster, 14086 versus 14221. But then when you take a look at it, there's over 53,000, I believe that is. Yes, 53,555 people that live in the 14221 zip code versus 31,847. So as a percentage of that zip code's population, Lancaster is actually worse than Amherst Clarence. So that's a key factor that the state's taking in. We will provide you afterwards the full set of data for all the zip codes that we can, which basically goes down to all the zip codes that have 5 or more cases. We'll do that afterwards, but we wanted to stress these because these are the highest ones. I know there's a question that's coming in.
Channel 7's having technical issues. The governor says that local and county governments need to enforce the rules. How is Erie County enforcing rules for private gatherings or individuals not wearing masks in public places where they're required?
Well, the question is coming in from one of our news stations, Channel 7, I guess having technical issues. How is Erie County enforcing the rules? Well, we first are sending off our sanitarians out to bars and restaurants and other locations, gyms and barber shops. It's also incumbent upon law enforcement. I mean, our healthcare sanitarians, when they actually enforce a violation, they usually do it with a local police department, whether it's the sheriff's office, Buffalo PD, or others. They can write up a permit, they can shut a place down, but there's certain technical violations that would require assistance from law enforcement. So we have to rely on our local law enforcement to assist us in this matter. There's a lot more members of local law enforcement and building inspectors in total than we have healthcare sanitarians. So there's a certain amount that Erie County Department of Health does. It's required to inspect these facilities. It is doing that. It is doing that on a daily basis and a nightly basis to ensure that compliance is being met. But when it's also in the general public, we need the help from our local law enforcement agencies as well. Moving on, then Channel 2, Kelly Dudzig. Channel 2, anybody else have a question?
Just real quick, are you concerned at all about parts of Niagara County being added to the yellow zone or being added as a yellow zone if we turn orange? What are your counterparts up there saying?
I think, first of all, I was on a conference call last week in which the chairwoman of the legislature, Rebecca Whittish, was actually in quarantine, like some of our other members of the legislature were, because of an individual who tested positive in Niagara County, though she at that point did not have COVID. And I know that she publicly mentioned that, so I'm not revealing any personal health data that's not otherwise known. But yeah, they're worried in Niagara County, especially about the area in North Tonawanda, which had some very high rates. So it's really, I don't know about the conversations directly that Niagara County is having with New York State, but I believe they are having those questions. And I know their director of the public health department is very concerned about what's going on because they're seeing increased rates of infection in key areas of Niagara County as well. Wouldn't be surprising if they put some of those areas into a yellow. Channel 4, George Rickert.
All the cases you've seen involving schools or discovered in schools, do you find that it's more likely that the school cases were actually contracted in the schools or outside of the schools?
It's more likely, George, that the cases are being contracted outside the schools, though we do have some evidence to show that there has been some case-to-case transmission in schools. However, the vast majority of cases are those where we can pinpoint that the person was probably infected outside the school, such as a student may have been infected from a parent who caught it from a coworker, or an employee of a school caught it from someone outside the school district. But I do know, having read some of the recent reports, that we've seen, not a big up, but we've seen a couple cases here or there where there is the possibility of transmission in the school. Aaron Ty, Spectrum. Anybody else from Spectrum?
All good, thanks, Mark.
Okay. I think we are all set for today. I want to thank, once again, Kendra Schmidt from Deaf Access Services for her great work in providing American Sign Language for our friends in the hearing impaired community. I want to thank Dr. Burstein and her staff for all the work they do. They were here on the weekends. They work hard. It doesn't shut down. I was at a testing clinic this Saturday. It got so busy there, I was directing cars. I mean, that's what you got to do in government. You got to get out there and help, and we got people working hard to ensure that we protect the public as best as we can, and that's what we're doing. But it also requires the public to play its role. We need you to wear a mask, wash your hands a lot, be smart when it comes to going out in public, avoiding the gatherings that unfortunately are a key driver of these new cases. A lot of them are from small social gatherings, whether it was Halloween parties, football parties, you name it, going over to Aunt Ginny's house. And Uncle Joe's there, and Uncle Joe's not feeling so good, and Uncle Joe passes it on to other people. Those are the things that we have to be careful of. And as we prepare for Thanksgiving very soon, I think we need to see what happened in Canada and how there was an increased rate of transmission among families and friends from Thanksgiving. We are not telling you to cancel Thanksgiving. We are saying do it among your own household. If you normally traveled to Aunt Ginny's house and everyone was around the table and the pumpkin pie was brought by your cousin and your family members brought the stuffing, Don't do it this year. Do what's smart this year. So next year, when we're all back together for Thanksgiving, there's not an empty chair at the table from someone who was lost because of the passing of COVID-19. Over 750 families in Erie County have had one person die in their family compared to where they were at this time last year due to COVID-19. We don't want to see that happen to any other families. We know it's possible and it's probably going to happen, but let's do our part to protect one another so that next year, when we do gather for Thanksgiving in 2021, we are all there and we can all remember what we did to get there. Thank you. Be safe and well to all.